Jaffe, if a person has an olfactory reaction to perfumes, will an LRA by ELISA Act testing show a sensitivity to the chemical or the ingredients in that?
A very important question, and the answer is a qualified likely or a qualified highly possible. But I'd really like to step upstream from the question. There are many and growing numbers of people today who are sensitive to perfumes and to deodorants and to other chemicals in the environment. What I learned many years ago was a classic technique called nasal lavage. You can also call this neti, N-E-T-I. You have a little ceramic thing that looks a bit like a teapot. At least that's the way I was taught to do it. I do prefer the ceramic, not the plastic ways of washing the nose. And in essence, you turn your head on the side, hopefully over a basin or a sink. You pour a liquid that, in my recommendation, would have minerals and vitamin C in it. You pour this into the upper nostril. It flows into the back of the nose, down into the lower nostril, and empties into the basin or the sink. Many people who are chemically sensitive have a very reactive, irritated olfactory bulb. The olfactory bulb is your nose sensing nerve. It's one of the cranial nerves, a very important part of the body. And when you bathe it in a balance of minerals, including potassium and magnesium and zinc and calcium, when you bathe it in a balance of minerals and antioxidants like vitamin C, it's like giving it a bath. And I will say that the first time that I and most people experience this, you should be aware that it will feel very briefly as if you're drowning because you're pouring a liquid into your nose. But if you do what has been done for millennia, you can do nasal lavage and reduce the reactivity to these environmental chemicals. The next suggestion I have is that if you are sensitive, then where you spend time, this could be your home, your office, could be your bedroom, your family room, your kitchen. But in each of those rooms, you can have a HEPA filter or an OPA filter with a charcoal replaceable filter and an ionizer. It's a trifecta. It's 3 components, one of which takes particles out of the air, one of which traps chemicals that are volatile organic chemicals, the so-called solvents in the air, and you charge the air for a variety of reasons using ions that are helpful and not harmful. You don't want ozone, you don't want it to smell like the fresh outdoors of bleach. You do want a contemporary HEPA or OPA combination air cleaner. Why? Because this will reduce your exposure to these irritating molecules. The next suggestion I have is to bring some plants into your environment that take chemicals out, and if you use any floral deodorizer, anything that you plug into a wall, anything that over time masks the smells, just don't do that. More good, less bad is part of our overall message. Nature's Alkaline Way uses nature to nurture and wholeness, including whole plants, to improve the quality of the air. And yes, appropriate technology like a HEPA or OPA filter with a charcoal filter and an ionizer. So yes, LRA by ELISA Act does test for solvents, does test for many of the common chemicals that are irritating, that are anti-nutrients, that deplete the good healthy nutrients in the body. However, when you get to individual floral or olfactory or nasal sensitivities, it is helpful to know about the neti nasal lavage. It is helpful to know about how to get more good in and less bad exposure for the individual. And then, yes, use the lifestyle program that we recommend, the LRA by ELISA Act test, the health appraisal questionnaire, because what you eat, drink, think, and do greatly influences how reactive your nose is if you do get exposed to perfumes or colognes or volatile chemicals, which, by the way, we often do. So be aware that there are things you can do to wash them away. There are things you can do to enhance the body's getting rid of them. This might include low temperature saunas for people who have accumulated these in their fatty tissues. And by low temperature, I mean 105 to 110 degrees Fahrenheit, so that an oily sheen forms on the surface of the body, and then you use a castile soap or similar, maybe with a loofah, to remove that oil, because it'll get reabsorbed if you simply go back out of the low temperature sauna. But I emphasize low temperature to mobilize these fatty oils, not the higher temperature that mobilizes water and sweat. If it's your own sauna, you can set the temperature. If it's at a health club, generally early in the day, they might be willing to leave the sauna on at a low temperature before the people who come for what my father used to call a schwitz, which means sweat and get water and talk to your friends and have a good social experience. Different kinds of sauna, low temperature to remove these oily solvent residues and other lipophilic hormone disrupting chemicals. And we build all of this together in what we recommend as part of the plan to evoke your healing responses once you have done the LRA tests and or the predictive biomarkers and the health appraisal questionnaire.